So we will start the last track, data science in healthcare. We have our virtual speakers who have joined us from Harvard Medical School, so they're with us. So let me introduce the panel, the moderator, Professor Ghada El-Hajj Fuleihan. Professor Fuleihan is a professor of medicine, physician, scientist at the American University of Beirut. It's a long, Ghada, it's a long bio. I'm gonna skip some of the full of achievements. So she's the founding director of the Calcium Metabolism and Osteoporosis Program, WHO Collaborating Center for Metabolic Bone Disorders, and the Scholars in Health Research Program at AUB. She has obtained MD degree from AUB and fellowship at Harvard, at Brigham's and Women's Hospital, Harvard Medical School. It's a bio full of achievements. I mean, she has over 190 publications. She's PI on several grants. She has obtained a long list of awards and serves on. She served as a clinical science chair and serves a 3-year term on its board of directors. She holds a lifelong appointment as the Bernard Lown Scholar in the Department of Global Health and Population at the Harvard Chan School of Public Health. So join me in welcoming Professor Fuleihan.
Good afternoon. Thank you, Lama. Really, introduction is kind of appreciated but not needed. It's my great pleasure to be with you today. At the end of the day, I promise you this is the icing on the cake. And thank you for staying so long. I think data science has seen an exponential increase over the last few years. This is just PubMed data science and healthcare. In 3 years, 42% of the output compared to 50 years. Data science in medicine, similar proportion. 3 years exponential growth, equivalent of half of what we've been giving in output over the last 50 years. We've heard different terms today, and all of them are very relevant, including our last panel. You know, analytics can be just descriptive, can be diagnostic, can be predictive, but importantly, can be prescriptive, so we can prevent adverse outcomes, so we can improve efficiency, so we can improve cost effectiveness, so on and so forth. This is the latest article from the New England Journal on Artificial Intelligence, and it just shows you how we've grown between the 50s in how much data we could actually store and what price we used to pay, coming to our smartphone, which is $900, with a huge data capability storage, and this is really where the money lies. The data science is a noisy field. We've heard about megadata, we've heard about trustworthy data, we have heard junk in, junk out, so labeling and trustworthy data is very important to allow us to make this trustworthy decision, give us knowledge and insight, predict adverse outcome, and do actions that will help us improve our society. We heard the term health, we heard resilience, we heard better environments, we heard workflow efficiencies, financial gains, and you've seen a wonderful day of rich presentation. This is now data science in the lens of healthcare. At the heart of it is data science, data analytics, and data mining, but it could apply to disease surveillance, and we'll hear a little bit about that from one of our speakers, privacy and fraud detection, healthcare administration, efficient workflows in hospitals to avoid crowding of beds, better use of OR, better use of clinics, allocation slots for appointments, mental health, public health, pharmacovigilance, and the list goes on and on. But today, we're going to focus on 2 other very important horizons, climate change, and unfortunately for Lebanon, human and man-made disasters. So the theme is data science in crisis management. We started with disaster response at the beginning of the day, moving on to public policy, smart cities, social goods, and back now circling to our original topic, which is crisis management. Data science is really our pillar for decision-making in disaster response and recovery, and those of us who think it's not coming on us would be fooling ourselves. We'd better learn it, we'll better understand its challenges, as we heard, its limitation, and its efficiency in making our lives better. It helps us predict how disaster risk may evolve in the future and enable us to use technology to be better prepared, prevent, and respond to disasters. And God knows Lebanon had its share of disasters. As you can see here is, do not forget the August 4th explosion. Climate change is again on the mind of many of us worldwide, regionally, and nationally, and Lebanon is no exception. And data science and climate change will be also relevant to our second speaker, which will study the effect of pollution on all aspects of life in societies: health outcomes, non-communicable diseases, epidemics and endemics, food supply chain, animal and marine life, and so on, so forth. Health is wealth. Health is the crown that we all carry over our heads and don't feel we have. Health is the fulcrum of all the activities we heard about data science and the various disciplines we've heard about. So it's really my great pleasure to introduce two amazing, phenomenal speakers, colleagues at the Harvard School of Public Health, Carolyn Buckey and Francesca Dominici. And we are here today because health is important. What we're doing at Women's in Data Science is important so that they may have life and have it abundant.